Broadcasting from our studios in Harare, Zimbabwe, welcome to this special show brought to you by Zimbabwe's television network and our partners, White Ribbon Alliance. Now, if you have any views or comments pertaining to the conversation we're having in studio today, please do go to our Facebook page, Zimbabwe's TV network, or our Twitter page at ZTN News. I am Samantha Rusare. Now, according to the World Health Organization, nearly 800 women die every day, every 2 minutes, from preventable causes related to pregnancy and childbirth worldwide. Our complications from pregnancy and childbirth are the leading cause of death amongst 15 to 19-year-old women worldwide. Also, 2.7 million newborns die every year within their first month of life, and an equal number are stillborn. Our White Ribbon Alliance is in studio with us today, and it is an organization currently running a global campaign to improve maternal health. And I am here with the national coordinator, Geraldine Nyaku, as well as their partner from Tony Waite, executive director, Ellen Vengere. Thank you very much for joining us and coming through to the studio, Geraldine.
Thanks, Samantha. Happy to be here.
All right. And Ellen, I know you're all the way from Kariba. Thank you very much for making time to come through to Harare in our studios to talk about these very important issues.
Welcome.
All right. So we are going to take a short break, a quick commercial break. We'll be here back after these messages.
What women want in regards to quality reproductive and maternal health care services for professionals to collaborate and coordinate care better. More intentional mental health care plans. Respectful care. No more judgments. Midwives to always be available for me. A specific facility for moms when they're having a mental health crisis. My doctor to screen and talk to me about my mental health. Zimbabwean women, have your voices heard. Let's influence policy and programming together to reflect our self-articulated needs and wants as women.
Thank you very much for staying with us. I am here in studio with White Ribbon Alliance National Coordinator Geraldine Nyaku, as well as the Executive Director of the Tony Waite Organization, Ellen Vengere. I'll just dive into our conversation. Geraldine, tell us more about your organization, White Ribbon Alliance.
Thank you, Samantha. So White Ribbon Alliance is a people-led global movement to improve reproductive, maternal, and newborn and child health and rights. And White Ribbon Alliance Zimbabwe, to be specific, is one of 14 national alliances across the globe. And we've been in operation in Zimbabwe since 2012, focusing on improving maternal and newborn health and rights. So that is what we've been doing. And now getting to the campaign, I think I'll give you more information on that.
All right. Now, to you, Ellen, give us also a brief background of the Tony Waite Organization.
Thank you, Samantha. Tony Waite Organization is a private voluntary organization registered under the PVO Act of Zimbabwe. So it's a legally registered organization, and it's working in Kariba district, both urban and rural. And mainly it's also focusing on women's health, newborn and child health, also being the reason why we are also in the WW campaign, so that we are getting issues from the concerned populace, because we are at grassroots level. So Tony Waite also provides adherence support for people living with chronic illnesses. As you know, they will really need to have that support, issues like psychosocial support. We are also working with orphans and vulnerable children. And as you have already said that mothers are dying, we are also feeding the babies from the mothers who die. So that's Tony Waite Organization. Thank you.
Amazing work that you're doing there. You spoke of the WWW campaign, What Women Want campaign. Geraldine, give us more insight on the What Women Want campaign and what is the main objective of the campaign.
All right. The What Women Want campaign is a global advocacy campaign to improve maternal and reproductive health for women and girls, and also to improve healthcare systems. So this campaign started in 2018. The global campaign itself started in 2018, and various alliances participated in this campaign across the globe. For example, Malawi, Tanzania, Kenya, Pakistan, India, and about 1.2 million responses came out of this campaign from women. And there were top 5 demands that came out of it. For example, respectful and dignified care, more skilled health workers, wash, water and sanitation and hygiene. So now we have launched this campaign in Zimbabwe so that we have the voice of the Zimbabwean woman to be heard. So we started this in Zimbabwe. We started in September of 2021, and then it's going to end in January 2022.
All right, you're speaking of the collective responses. Who are they intended, or who are the results of those responses intended for?
So the results that we get from the women, or the responses rather, their wants, they are going to help to feed or inform health policies, programs, and activities to reflect the self-articulated needs of the woman. So when you find that when healthcare systems have the voice of the woman, you find that it's better healthcare. So we want to put the voice of the woman at the center of all healthcare systems.
All right, Ellen, you work closely, well, this is, of course, at grassroots level, I'm sure, in Zimbabwe, and you work closely with different women in different societies, I believe, who are the beneficiaries of this campaign. How has it been at grassroots level, working with these women and working together with White Ribbon Alliance?
Yeah, thank you. I've noted that women are quite happy to be participants of whatever change comes, because if they are not involved, then it's not for them. So with us, we have noted that they are quite happy to talk about their issues. Some of them might say maybe the clinic is too far away, they would like a clinic. So this will actually address policymakers to make change according to the voice of the women and not leaving the women in the village.
And some of those responses, I'm sure there are issues that have been spoken about or talked about by different people with regards to maternal health. What are some of the topical responses from these women, issues that are affecting them on a day-to-day life in society?
What is actually coming out more is that women would like to have free maternity delivery, so that even if you are not able, you have a child who is alive. And it's not going actually to chase them away from attending the clinic, because they know they will be having the delivery packs free of charge. But if they are not free, some of them will resort to deliver at home, and this will always maybe not improve the maternal and reproductive health that we are looking at.
All right. Geraldine, how different is this campaign from other campaigns that have been held previously worldwide and locally?
What's unique about the What Women Want campaign is that it has an open-ended question, really. It says, what is your want or your request with regards to reproductive and maternal health services? So you can say whatever it is that you want. You're not restricted.
Am I allowed to say what I want?
You are allowed to say what you want. So you find that women, we are all different. We have different needs. You can't say one size fits all. Every woman has the unique needs, as we are all individuals as much as we are all women. So it's a very much open-ended question, and it looks at the wants and not the complaints. So we're not looking at what is wrong. We're looking at what do you want done right. So it's more solution-driven. And White Ribbon Alliance has always encouraged the collaboration between citizens and governments. So you find that in this campaign, we are not working alone as White Ribbon Alliance. We have Tony Waite organization among other stakeholders that are involved. And obviously, our parent ministry, the Ministry of Health and Child Care, is really involved in this campaign as we complement their efforts in improving reproductive and maternal health around the country.
Earlier on, Ellen spoke about respectful and dignified maternal care. And I think most women in the country who have received, especially in the public health sector, who have received maternal care in that domain, have a few comments about that. Maybe you might look at them as complaints, but I think since you've mentioned respectful and dignified care, it's something that you need to look at. What are you doing, Ellen, as the Tony Waite Foundation, Tony Waite organization, to curb some of those objectives that you're looking at, respectful and dignified care?
Yes, it's a national campaign, and also at district local level, whereby the results can be spoken to the responsible ministry, because they are the one who can make the change, although mostly it's for policies, but also at local level, we can communicate what women are saying with our local clinics, so that if whatever they can manage to change, it can be changed, because it's what they want, not what has been happening to them. But if we go and say maybe the women want medication to be available, so they will also make some efforts to make medication available for them.
Maybe can I maybe add on to what she said when she talked about the district level changes at district level. I just want to give some of the success stories that came out of this campaign from the previous participants, such as White Ribbon Alliance Malawi. So in Chitipa district, if I'm not mistaken, and in Chitipa district, one of the top demands that came out was water and sanitation and hygiene. And the district management committee of that particular district then acted upon it. They started improving the health facilities of that district. They started putting more boreholes and so forth. So it means that their responses allowed the duty bearers to act upon those demands, well informed and redirecting budgets to what is really important. So I believe that in Zimbabwe, this will also help us to inform our programming, to inform our policies on what is it that the women want.
What women want. You are watching a live discussion on a global campaign on women, and today we're narrowing in on maternal reproductive health service. And this show is brought to you by Zimbabwe Television Network in partnership with White Ribbon Alliance. We'll be back after this break.
What women want in regards to quality reproductive and maternal health care services for professionals to collaborate and coordinate care better. More intentional mental health care plans. Respectful care. No more judgments. Midwives to always be available for me. A specific facility for moms when they're having a mental health crisis. My doctor to screen and talk to me about my mental health. Zimbabwean women, have your voices heard. Let's influence policy and programming together to reflect our self-articulated needs and wants as women.
Welcome back to this special program, proudly brought to you by Zimbabwe Television Network in partnership with White Ribbon Alliance, where we are talking about maternal care and especially looking at the global campaign, What Women Want, being currently run by White Ribbon Alliance. Geraldine and Ellen are in studio with me, and we were delving into the campaign and what's happening, especially on local level. I was particularly intrigued by some of the responses that you got, that you were talking about as an example in Malawi and what's been happening. And that's something that we would want to see in Zimbabwe as well, some of the developments that we're also, I'm sure you're also aiming to see in the different districts in the country. Now, Geraldine, what was the process of collecting responses? Was it the same in every country? How did the process impact answers? We spoke of Malawi. Let's look at other countries, especially those who are not in Africa, maybe in other continents.
Thank you, Samantha. So when the campaign started in 2018, it was offline. So it was from door to door, people meeting in person and getting responses from the women. But now when we started this year in Zimbabwe, obviously we have to take into consideration the COVID-19, and we had to now strategize on how to get to the women apart from physical meetings, but also online as well. So the campaign takes a hybrid approach that we still do the one-on-one in-person taking of responses, and I think Ellen will speak to that. But we also have our website, online website link that women can go onto and enter their responses. So it's very convenient as long as you have access to internet and access to data. So the in-person works obviously for our women in the marginalized communities, where organizations such as Tony Waite works in and can actually get in touch with the community. As we said before, we are a grassroots movement, so we believe in moving together and not individually. So then we also have another approach that we're going to take through WhatsApp group. We know a large percentage of the population of Zimbabwe is on WhatsApp, but that will be available in December. So definitely we will come back to you, Samantha, and tell you of the link for our website, for our WhatsApp platform. So for now we have the paper responses, then we also have the online, and I think Ellen can delve better into the paper responses bit.
All right, and just to let you know, viewers at home, that this is an introduction of the campaign, this show that is, we're going to have another show in December and another one in January, where we're going to be really looking into what has been happening on the ground. Today is just an introduction of the campaign to you. Ellen, tell us about how you are collecting responses in the district, and how has that been, and what are some of the challenges as well that you've faced whilst doing that?
Okay, what we have been doing to collect these responses, as an organization, we do not work in isolation. We also work with other local organizations within our communities, and each organization has got community carers, those who are quite close to the people. So in introducing the campaign, we came together and discussed what our expectations were. And when they got the expectations, we actually had to give them the stationery, so that we would only want one good response from you that will say you have received quality reproductive and maternal health at your clinic or hospital. So this is quite interesting. The thing is that it goes back home to say, I'm living in such an area, and we are bound to have different responses depending on which area some people are coming. Some people might be having the clinic closer. Maybe what they might want is a good welcome. And if someone has a good welcome, no matter what happens later, maybe issues like maybe you might have the drugs not available, but if somebody has communicated to you quite well, you feel free even to come back to such an institution. So these are some of the issues that are actually coming out. And one good thing is that it's on one-on-one, and someone will be just free to spell out. And when we ask about one response, oh, imagine we are getting 2, 3, 4. Then you say, among all those, which one exactly would you say this is what you want as a woman, as a girl? Because we are also considering young women, because they are also using the facilities. We are also even considering old women, because they also, about your health, everyone is bound to visit the institution to get help. So as long as you are a woman, you are just involved in it. And it's something that you see even old women saying, I think they need to have more midwives because of the experience. And also me as a grandmother, I have been a mother. I've also come being a girl. And those experiences are counting. When I was a mother, someone you give birth and someone come to say, congratulations. So you can see that maternal health is quite important. That's why they use these words, makorokoto, congratulations, amhlope, so that at least you know it's something. So imagine if someone delivers a child who do not survive. What does it mean to that mother? It's a psychological trauma. So this is quite important on this campaign to say what women, and we just hope whatever is coming out will just be dealt with and try and address what the women want to see at their local institutions, so that at least we have a happy woman in the community. And they also know that Tonweight is working with women. So I'm just urging them, from now, we might not have reached you, but you are free even to visit our offices. You are even free to talk to our community carers about what you want, because the campaign is still ongoing.
I'm happy with what Ellen has just said when she says the campaign is for every woman. It has to be clear that as long as you're a woman. So this campaign, like you said before, what's unique about it? It's cross-cutting. We're not looking at a specific class of women, but it's cross-cutting economic, social background, academic background. As long as you're a woman who is residing in Zimbabwe, it cuts across even race. So as long as you identify yourself as a Zimbabwean and you reside in Zimbabwe, your voice is required in this campaign.
That's wonderful. Ellen, you've been in the district, you are in the district, you're talking to different women. And for me as a journalist, I know that sometimes collecting information, particularly from women in a hospital, can be a bit of a challenge. What are some of the challenges that you see whilst you're getting some of these responses, and how is the response actually? How is the uptake of responses from the women in the community?
The challenges that we are facing have got actually nothing to do with the responses. They might be to do with our distances, where we are operating from and where we need to reach. I think those are some of the challenges. But as of women, they always say, what is happening if they see you talking to someone? What is happening? And they also come and say, can we be part of it? So I wouldn't say we are facing challenges on responses, but our challenges might be distances that we need to travel to rural areas and also collect the information from the rural areas. Those are some of the challenges that we are actually facing.
That's great news to hear. Now, Geraldine, how wide is the coverage of this campaign so far?
Okay, the campaign has to cover the whole of Zimbabwe. Though White Women Alliance Zimbabwe has been operational in 3 districts, mainly Harare, Bulawayo, and Kwekwe, but the campaign is covering the whole of the nation. And you wonder how are you going to get the voice of every woman? I go back to, what I said before, to say that we work with various organizations that have partnered with us in this campaign. And for example, Tonweight organization is in Kariba, and that's Mashonaland West. So we are trying to cover all provinces with the assistance of our partners. And also the online platform will definitely reach to everyone.
And how long will the campaign be running?
From September 2021 till January 2022.
All right. Now, I know Ellen did mention that she isn't facing many challenges in terms of being on the ground, with the women on the ground in the district of Kariba. But maybe if you can also give us some of the, I know challenges will always be there in terms of due to the COVID-19 pandemic. Did you face anything that probably hindered you from getting the amount of responses that you were expecting due to the pandemic?
Yes, there's the issue of just the stigma around the virus, the COVID-19 virus. And we've seen that there's been a lot of fear in women, especially pregnant or expecting mothers. It has been a huge challenge for them to actually come out and interact probably with the mobilizers, obviously adhering to the COVID-19 restrictions. And I think Ellen can even shed more light as she has interacted with the community on the ground?
I think we can actually talk about challenges during the COVID-19 on reproductive health and maternal health. As we are all aware, there were restrictions to movement, there were restrictions to gatherings, and this also affected women going for antenatal care because of the restrictions. And you know, when COVID-19 started, I think there was a lot of confusion. Nobody knew what to do. It was a trial and error until maybe now people are aware that we can actually do 1, 2, 3. But when it started, it was quite difficult. I think even now when people were asking, can pregnant women be vaccinated? But our ministry, I think, is working tirelessly to give information on who can be vaccinated, and now people are quite aware. But the restriction of the COVID-19, things have just started easing because of the regulations that have actually is changed, that people can now meet in groups also, but we still need to observe sanitizing of hands and avoiding maybe also having social distancing. So some of those things we really need to observe them, though we are now able to gather and get responses from the women. But during the COVID-19 era, when it started, restrictions were quite a barrier to the program.
All right. Now, as we have learned today that this campaign is for each and every woman out there, please tell us, how can we as well get in touch with White Ribbon Alliance or Tommy White Foundation to talk about what we feel we want as well, online or on the ground? Where can we find you?
www.whatwomenwant.org/Zimbabwe. That's our online platform where you can put your responses wherever you are, as long as you have access to internet and you have your data. Then for more information, to know more about us, White Ribbon Alliance, what we're all about and where we can be found, you can go on WRAZW1. That's our username for both our Twitter handle and our Facebook username.
All right. Any last parting words, Ellen, that you have to women who are listening to you out there, watching you out there?
Yes. As Stoneweight, we also have a Facebook page. It's Stoneweight Organization. So you can also go out to our Facebook page and you can link with us. You can even ask your questions. And physically, we are at stand 3367 Jumbo Industrial, Kariba. And also, our website is www.tonweightorganization.com. So you can even reach us physically, or you can actually use other social medias to get hold of us. And you can also use the following number, 0772 223 646, if you want to ask any questions, and you'll be responded to.
All right. Now, to close off, ladies, please tell us, what should we look out for in our next discussion that's we're going to hold in December?
Okay, thank you, Samantha. In our next discussion, we're going to discuss probably about the responses, how much we've gathered, what has really come out from the women, because we'll be probably almost 3/4 through the campaign. So I think it'll be amazing for everyone to know what we've done on the ground, the responses and the numbers and the type of responses, and also the players, other players that are in this campaign. You would definitely want to get to hear their own point of view and their experiences, including probably even mobilizers who have been on the ground to come on the show and give you an insight into their experiences.
That's great, Geraldine. Thank you very much, Geraldine and Ellen, for this amazing discussion. And we wish you well in going out there to get as many responses from women on what they want. You have been watching a discussion brought to you by Zimbabwe's Television Network in partnership with White Ribbon Alliance. I would like to thank our two panelists once again. Geraldine Nyaku, who is the National Coordinator of White Ribbon Alliance, as well as Ellen Vengere, who is the Executive Director of the Tony White Organization. Thank you very much for watching. We will be back again in December, mid-December, to talk about how this campaign is going locally. Thank you very much. Enjoy your viewing.